Our next speaker is Dr. Marsha Griffin, who will address unaccompanied refugee minors supporting their health and development. Dr. Griffin is clinical professor of pediatrics at the University of Texas Rio Grande Valley School of Medicine and the director of the Division of Child and Family Health. She is a pediatrician at the Brownsville Community Health Center, where she cares for immigrant children daily. Dr. Griffin is also co-founder and director of Community for Children. Please join me in welcoming Dr. Marsha Griffin.
Thank you very much for this invitation. It's quite humbling to be sitting in front of all of you today, or you be sitting in front of me, I'm standing in front of you. The first thing I want to do is, and I'm looking for the clicker. Here it is. The first thing I need to do today is thank these two guys. Thank you, Bernard, for making this a part of your legacy as a president, for caring so deeply that when I said, could you come to the border, you said, when, how fast can I get there? Thank you. And to Fernando Stein, who has picked up this mantle and he's carrying it high. These two gentlemen came to the border to bear witness for the children. And they're not done. They're coming back in 2 weeks to make sure they see what's going on with the children. So briefly, they came to the border, and the purpose was we were going to go into the Border Patrol processing centers that we had heard so much bad press about. The hieleras, the pereiras, the places that were so ugly where children were being kept. And then they were going to go see where the unaccompanied children were kept. And they were going to go see that famous border wall. And then we were going to go to Sacred Heart. And at Sacred Heart, they were going to see the lucky families who were released to join their families across the country. A week before they arrived, the Border Patrol told us that they had changed their mind. We were not going to be allowed to go into the processing center. That did not go over very well. The pediatricians wanted to know, what are you hiding? Why can't pediatricians come see what you're doing inside these walls? There were many of us who wanted to get stripped down and protest outside the processing center. But Bernard calmed us down. And being the diplomat that he is, he convinced them that we have the same goal, to make sure kids are cared for in the right place. And so they're coming back. So I want to show you just a couple of photos from that. This is a photo documentary that's on the web, online, and it's done by Veronica Vero. She put these shoes all singly in a row. This is Sacred Heart, and this is where the children can sleep and their parents. Normally, they're piled high in piles because they have to take their clothes off to change into clean clothes, and they also have to discard their shoes. So normally these are in large piles, reminiscent of the Holocaust Museum, and where you see the piles of shoes, or Auschwitz, where you see the piles of shoes. She put these singly because she wanted to highlight that every pair of shoes has a story. These belong to Luis. He's from Honduras. He came with his dad, who's 8. He came with his dad, Luis is 8. And I could tell you stories about Luisa, who also came with her grandmother. She was 17. At the last minute, because she wasn't her mother, the Border Patrol ripped her hands away, sent the grandmother on the bus, and said, "We're taking her somewhere else." There are many other stories like that. But I want to talk to you today about three things. That every child has a story. And as Dr. Searin said so well at the section on international child health, every child needs to be able to create their own dreams, and they need to have a safe place in which to grow and develop. And what I want to share with you is there are ways for all of us to help them achieve this. And I want to let you know that it doesn't take that long. It doesn't take but a moment for an immigrant family to know that you care and for them to feel safe. I was given permission to use this photo. This is a gentleman from Honduras, and that's his little boy. And I'd like to say that they ran into two compassionate pediatricians, Dr. Padma Swami, who you see kneeling at the side of the table, and Dr. Alan Shapiro, who was sitting talking to them. It only took a moment for that man to know that he was trusted and safe. And then he unloaded his story of the murder of his father, the separation of his family, his journey to another country, and then finally to us. And he had never told a single soul that story. I call it the power of Padma and the heart of Alan. So why is this important? UNICEF came out with a recent report called Uprooted. And in that report, according to UNICEF, there are over 50 million children displaced around the world today. This image, hard to read and difficult to decipher, is really a graphic of those children swirling around our country. We're only the top left small corner up there. Those, and you see, although we get children from all over the world, most of them are coming from Central America and Mexico. According to the United Nations High Commission on Refugees, the number of children of refugees has doubled in the last decade. Half of all these 50 million children are fleeing violence and insecurity. And we all know they bear no blame for the wars, for the conflicts, for the poverty, and now for climate change that is pushing them out of their home. But they are and will remain the first to suffer. The migration is not going to stop. The trauma and the violence that is inflicted on them and their families can be stopped. And we can be a part of that. So in the United States, we have an estimated 3.7 million immigrant children. And we have 11 million undocumented immigrants that we've all heard in the debates. 82% of these undocumented are concentrated in 14 states. However, there are at least 20,000 in 41 states, and DC are home to these undocumented children. What that means is that what Dr. Racine said, that we have the ability to care, and its proportionality and distribution. But the real issue is if we have this many children and families in our country, this is no longer an immigrant problem. This is a public health problem, and it's a human rights violation to not provide all children with access to health care. Okay, I have to confess, I'm from the South, and I don't know if you guys know any Southern ladies, but we talk kind of slow, so I'm going to have to rev it up now and not draw out all my words. So why me? I live on the border of Texas and Mexico. This is where I live. I see undocumented immigrant children. Also, in the last 10 years, I have run a program called Community for Children. And Community for Children brings young physicians, medical students, residents, fellows from all over the country down to the border, and we immerse them in the community. And because we're an immigrant community, they are immersed in the community of immigrants. They're working in these shelters, they're working at Sacred Heart, they're caring for these children on a personal level. And I have to tell you, it is their outrage, their passion, and their determination that keeps me going. So for any of you who are in this audience, thank you very much for your commitment. I also have worked in a federally qualified health center for the last 10 years, and we definitely see the poorest of the poor. Almost all of my patients were undocumented or their parents were undocumented. Now my clinic is a mobile van, a medical van, that we see in that van the homeless immigrant children. And this is what they tell me. On the walls of Central America, little towns, and in Mexico, this is the threat: ver, oír y callar. Or this could be your child or you. So this is why they are running. I also need you to know that the dangers do not stop when they get to our country. Whether they turn themselves into the Border Patrol or are apprehended, or they fall from this wall and I see them in the clinic with broken vertebrae and broken ribs, the dangers or the journey have not ended when they arrive. Border Patrol and ICE, Immigration Custom Enforcement, are law enforcement agencies. They are not trained to take care of children. They're the largest policing force in our country, and there is no accountability for what they do. Over 70 immigrants, including children, have been killed by the Border Patrol, and there has been no accounting for that. There have been women and children raped, and there has been no accounting for that. These children, these women, this organization needs to be monitored so this stops. Many of the sons and daughters of our community are members of the Border Patrol and ICE because they're the biggest employers in our region. They're good people, but it only takes a few bad hombres to wreak havoc. So we need to control that. So whether they are, let me get to the next slide, I'm sorry. So now I'm going to talk about the children. And if they're with a parent, the minute they're apprehended or they turn themselves in, some are placed and they go through Border Patrol, and some are placed in ICE family detention centers. There's only 3 in Carnes, Dilley, and Burke in Texas, and Dilley in Burke, Pennsylvania. There are currently 3,300 beds holding these families. Your leaders have gone into these facilities and come out and said, this is no place for a child. The conditions in there, they have lack of year-round education, they have lack of access to mental health care, they don't have quality and ongoing medical care, there's not enough interpretation services, there's lack of legal access, and it's a world in which they don't know when they get out and they don't know what the outcome is. Our own Judy Dolan went into these and became a member of the Department of Homeland Security Advisory Committee. She came back and that committee wrote a report that is scathing. And that report, they were tasked by the Department of Homeland Security to give them recommendations. Well, they gave them recommendations. And basically what they said is detention of a child is never in the best interest of a child. Thank you, Judy. These are the numbers. I'm not going to count them. They're going up. Also, if a mother and father come to the border with their child, the father is separated. He is taken to an adult center, and this is the Untold Stories. There are 209 facilities all over this country with 34,000 beds in it. The number that are detained from our communities, and your communities that are doing ICE raids are either deported or they're putting them there. This is a huge industry. These are the children's parents. We need to pay attention to this. So what about the unaccompanied children? That number is going up as well. So if the children turn themselves in, they're also taken to these terrible processing centers. They go through the same thing, but by law, they can only stay there 72 hours, and then they need to be taken to an Office of Refugee Resettlement shelter that is under the Department of Health and Human Services. They are charged with taking care of children. So they go there. Their mental health workers, case managers, physicians, social workers, and others come together to process these children as fast as they can to get them to safety. They're not perfect. They're better than Border Patrol or ICE facilities. But of the 60,000 that they take care of in these institutions every year, there are at least 700 that most of the time the children are out within 30 days and on to their families or sponsors. But there's at least 700 that don't know when they'll leave. There is no due process in Office of Refugee Resettlement shelters. If the child misbehaves, if the child talks back or gets in a fight, they may be over-medicated. In some cases, they have been put in 4-point restraints, and a girl of 5 is still there at the age of 7. We cannot forget these children. So all these children, when they come to your clinic, and your first reaction was like me, oh my God, now what do I do? And so I've been tasked with also telling you what they need. And this is what they need. Their families and the children need access to trauma-informed, culturally sensitive, comprehensive care that is covered and includes mental health and interpretation services. They need an HBI that includes abuse, persecution, trauma, neglect, domestic violence in their country, many more, but that's all. We're going to give you a tool to help you figure that out. They need legal representation, they need education, they need to be integrated into their community, and there's many programs in this country that are already doing that very well. They need access to education because it's a right, and so they need to be in school. They also need opportunities to create sacred spaces of peace that they design. I want to tell you just briefly, after we had published an article in Pediatrics on children's lives on the border about the toxic stress, and in doing the research, I read Dr. Shonkoff's articles, and in every one he says the institutions of medicine, law, and education need to come to work on the toxic stress, to address the toxic stress. And I thought, that's what we need down here. And so we brought together on Valentine's in 2014, before the surge, all these leaders from medicine, education, law, the community, architects, journalists, writers, to say, what do we need and what can our community do to tell these children, we love you. We want you here. And one of the things was they came up with 500 ideas. And one of them was, we need public spaces and public art that are places of peace and that have art that says we love you. In our clinic, we ask the children and the mothers of the children to come together and talk about the wall and their past and their villages and the struggles and the fears, but also talk about what would a community look like that was peaceful, that was theirs. And this is what they came up with. This was their design. They painted it. Neighbors were sitting on their front porch and came over and helped. They got excited, and on the side that you can't see, the kids wanted to write, "Butterflies are free, why not me?" So what do you need? Let me get through my papers. What do you need to help children like this? And here's some tools. The AAP Immigrant Toolkit has been designed for you. The AAP Trauma Toolbox has ways for you to start becoming informed and inform your community. Engage with your community partners who can help you. And there is a new tool that many of you use forever. It's called Migrant Clinician Network. They were started decades ago for migrant farm workers. And those people, the physicians and the case managers, managed in the past tuberculosis patients, farm workers who were going north. Now they help with the mobile poor. I'm so impressed with them. I now sit on their board, but I have no financial disclosures to tell you about. I only want you to look them up. There's their website. The way you do it is, I have a patient whoever it is, who has a chronic illness or has a problem, they're leaving my community, and maybe they're going to Winston-Salem or the Bronx or wherever, Florida. I call them, I enroll my patient with Migrant Clinician Network. That patient becomes theirs. I upload their records. They have a network, an unbelievable network in this country and 111 other countries. They find the appropriate clinic for that family. They make sure that family gets there, they contact the doctor, and then they let you know that they were taken care of. You too can sign up your clinic to this. It is free service. It is free. You can sign up to be a clinic that will take care of these children, but you have to see them for free or on a sliding scale. Last, I need to thank the members of the Immigrant Help Special Interest Group. This is a group of over 200 passionate, committed doctors who are seeing refugee and immigrant children every day. And they are creating resources for you and me to use. And most importantly, they are carrying the stories of their children to the rest of the world. So what we would ask you to do, our hope, is that you will see and you will be able to listen, and then you will refuse to be silenced. Thank you.